Hi everyone. We are just going to get started in a few moments. We're just going to give it maybe a minute or so for people to join us. Since it is the lunch hour, depending on where you are. So we'll just give people a little time to grab some food, some water, kind of get settled into our into GoToWebinar, and we'll get started. For those of you who have joined us, thank you for joining. I'm not sure if GoToWebinar may be new to you. There is a chat box on the control panel on your screen, which we'll use for interacting with Chris, our great presenter today. So please feel free to type out questions in that chat box, and I will be monitoring throughout. So I'll pop on and let Chris know when there are questions. There is a raise hand function. If you do raise your hand, I see we had one of those happen already. Please feel free to just type into the chat box the question you have, and I'll do my best to answer them if it's a tech question, or pass it along to Chris if it's a question for Chris. So more people are joining us. This is great. Okay, so to get started, thank you all for joining us this afternoon. We know that there's a lot of online opportunities these days due to COVID, so we're just really grateful that you chose to spend this hour with us today and Chris. My name is Anna Guida. I'm the project manager for Empower Idaho. Empower Idaho is a nonprofit that serves all of Idaho. We provide education and advocacy for adult participants and providers of behavioral health services throughout the state. So we do lots of webinars like this. We also do live activities that are now online due to COVID. We also do lots of awareness campaigns, and we have a really robust newsletter that we encourage you all to join and follow to learn about more great opportunities like this one. So moving on, we want to introduce Chris. Chris Rawlings is our presenter for today for Treatment on the Reservation, Assisting Native Populations with Mental Health and Substance Use Disorders. I'm going to do a quick intro for Chris and then just kind of hand it over for him so we can get started. So Chris Rawlings takes great pride in being a local to Bonners Ferry, Idaho, though he has lived and traveled literally all around the world. Chris received or earned a bachelor's degree in Boise State University, go Broncos, I'm also a Broncos, go who, in health promotion and wellness. After a decade of work experience, he continued his education at Bastyr University in Kenmore, Washington, obtaining a master's degree in systems therapy. Boundary County is the home of the Kootenai Tribe of Idaho. Chris has had the opportunity to engage tribal members in treatment for the past 10 years through private practice, and for the past 2 years, he has worked through the tribal clinic for the Kootenai Tribe on contract to assist tribal members with substance use and mental health disorders. Chris's theoretical orientation focused on family systems, as well as working with substance use disorders in a client-centered, strengths-based approach. Chris, along with his wife and fellow therapist, Treva Rawlings, established Rawlings Community Counseling in 2010. Chris and Treva reside in Bonners County with their dog Skylar, where they enjoy being active in the outdoors. So we're so grateful for Chris to be here today, and we just can't wait to learn with you all. So that said, I'm going to hand it over to Chris. So thank you, guys.
Excellent. Well, thanks, Anna. I appreciate this opportunity, and I'm genuinely honored and humbled to be able to address this topic, because it's something that I definitely feel passionate about and have a lot of energy on, and I'm enthusiastic about other people working with this population and learning from each other. Appreciate being a part of Recovery Month here as September comes to a close, and appreciate everybody taking an hour of their lunch hour or late morning / early afternoon, depending on the time zone, and coming in and being a part of this. I'd really like to start today by saying that I recognize fully that I am only one guy working with the Kootenai Tribe of Idaho, and I've got a little additional experience with the Inuit populations in Alaska, but I do not pretend to be a great expert in all areas of every native tribe. All of my statements this afternoon can be understood as being based on my experience with the Kootenai Tribe of Idaho, knowing that other people in other areas could very possibly have different experiences, other needs, different requirements. So I'm going to be coming from my experience as somebody growing up and living in North Idaho and working with the Kootenai Tribe. And like I say, I fully recognize that, that's a very thin slice of a large pie. I did grow up in North Idaho. I was fortunate to call Boundary County my home, and it is also the home of the Kootenai Tribe of Idaho. So I've got an advantage in that I had peers in school that were tribal members. I was teammates with tribal members in sports in school. My mother and father have friends and colleagues that are tribal members, and I recognize that absolutely has had a positive influence. We live in a reasonably small town, and so a family name goes a long way, like it does in many small towns. And the Rawlings name, I don't pretend like we're super famous or anything, but I do take pride in the understanding that the family name has credibility, and we've worked hard to earn that credibility within the community, and that includes the Kootenai Tribe of Idaho. And I say all of that because it definitely has had influence on my ability to network with the tribe and to get in with the tribe in ways that other people might not have that same opportunity. And so, I'm encouraging other people to work. If you don't have that type of reputation that I'm fortunate to have inherited, work to cultivate it, because that's an important piece. I also want to say that the Kootenai Tribe of Idaho, in my situation in working with this tribal contract, is completely safe. And I know that also is not always the case. I remember very clearly when I took the contract, when I accepted the contract to work with the Kootenai Tribe, people were saying, oh, be careful out there, the res is dangerous, asking me if I was afraid and these kinds of things. And I can say with 100% confidence that there is no more physical danger for me on the res than there would be in private practice. Actually, probably the opposite. Given the dynamics of the reservation and the tribal police being right there versus in town, and some of the people that we work with in the private practice and whatnot, I'm very comfortable and safe in working with the tribe. And there may be other places where that's not true. For example, Browning, Montana, people in Browning, but like Browning's rough. Browning is a whole different deal, and the population, the dynamics of the tribal population and the Caucasian population are very different. For example, if a white person goes to jail in Browning, they absolutely have to separate the whites and the native population, because the white people will get stabbed. Like that's just kind of a known fact. That's the way it is, and I'm not exaggerating. So they have it set up so that they can have some people here and some people here, and so definitely if you're working with native populations, you want to with any population, we want to make sure we're safe, and I'm very comfortable in saying that's not really a concern for me. So I don't really think of it through that lens, and so I'm grateful for that. I recognize that we have an hour, and in an hour that is going to be less than the tip of the iceberg for this vast topic of working with native populations. And I've been doing clinical work with, as Anna said in the bio, with native population for about 10 years, and it's been about 2.5 that I've been specifically contracted through the tribe. And I really feel like I'm learning every day. It's an ongoing process. I'm an open learner, and I look forward to relaying some of that onto you, and hopefully with an opportunity to be receiving some education as well. Because like I say, I fully recognize that I've got a little slice that I'm fortunate to be able to share with you today. So with all that being said, I'm going to dive in and move forward with the PowerPoint here. The first 3 slides on this PowerPoint are are really married together. They're interwoven in a lot of ways, as you'll see as we progress through. There's starting with, I feel like it's really important to address being Caucasian and working with tribal members. Like, that's a thing, right? How do white people go in and work with this population that is understandably cautious? And like I say, we've got the first 3 slides here are about being Caucasian and working with tribal members, and then pardon me, talking about earning trust, and then some research and creating greater understanding. But starting out with addressing being Caucasian, I would encourage, and certainly I personally don't pretend to be something that I'm not. If wearing turquoise and headdress and beads and wolf t-shirts and all of that we see, that I see when I'm out at the res, if that's your thing, great. But if it's not, don't pretend to be something that we're not. And of course, I should say this caveat as well. The vast majority of what I will say is applicable to multiple populations. That would be true with any population, but certainly as I'm working with tribal members, I try and really be authentic and encourage others to be authentic as well. Don't pretend to be something that we're not. I remember in bullet point number 2, being mindful. When I first got the contract, I was very excited. I felt really honored. This was an incredible opportunity for myself and for Rawlings Community Counseling, the agency that my wife and I have developed. And so I wanted to get like art for the walls and decorate the office out there, and was looking up stuff on the internet, and a close friend, Sean, who works for the tribe, and was talking to him about it, and he said, wait, pump the brakes, be careful. And one of the things that he educated me on that I wasn't aware of is how many different conflicts there are within tribes. And of course, as a white guy, I don't know what those are. And he definitely opened my eyes and encouraged me to be conscious of the different conflicts and history of other tribes, and things that I might not think are a big deal, they might think are a really big deal, and vice versa. Things that I might be like, whoa, I wouldn't put that on my wall. Ask a tribal member, and they'll be like, oh, yeah, it's not that big of a deal. But encouraging us all to be mindful of the specific tribe that we're working with, and conscious of how we approach it, get some guidance, ask for some assistance from tribal members on what may or may not be appropriate. On the obvious, and by that I mean saying, I'm a white guy working with tribal members, and just really throwing it out there and shining light on the obvious. I tend to, in general, use a sense of humor in my life and in my practice. And the Kootenai Tribe, like all human beings, they're stinking hilarious. Like, once you get through, there's a very rich and developed sense of humor with my tribal members, which I absolutely appreciate, and that can really be helpful in terms of breaking down barriers and coming to common ground. Humor is a very valuable tool. I also think it's very important to verbalize and validate the recognition of the tragic history of the tribes of North America, and not try and avoid it. Quite the opposite. I lean into having those conversations and trying to discuss as openly and transparently as they're comfortable with in that tragic history, and recognizing some of the things that my ancestors did to their ancestors, and trying to have some of that common ground, and not try and avoid it, but like I say, genuinely embrace it and validate that and address it directly. Ask about incidents of prejudice and racism. I remember this happened a number of different times, 2 or 3 different times, where clients that are in their, late teens, early 20s, and I'll ask them about their experience with prejudice and racism in the Northern County here in Idaho. And each time that this has happened, they kind of pause and then looked at me and said, nobody has ever asked me that before. And it struck me as to how powerful that can be, just to recognize it and ask what their experience is like, because oftentimes I will assume that people had that conversation and that they talked about it, and I'm realizing after some real direct contact with the Kootenai Tribe of Idaho that they don't have that voice, that they don't have the opportunity to recognize and process some of that. And finally, in terms of this slide, it's important to recognize that as the therapist, I'm not the only Caucasian professional that they have interaction with. Unfortunately, there's not a lot of Native professionals in Boundary County, and so they don't really have that pool to draw from. So there's some assistance in that they're used to working with white people, and that has advantages and disadvantages that we'll talk about as we progress. But certainly the public school teachers, I believe there's one Native woman, Kootenai tribal member, who is a teacher at the public schools. Out of all of the grades in all of the schools in Boundary County, there's one. So they're used to having teachers. All of the tribal, the health clinic, the nurses, and the doctor she is a white woman that works at the tribal clinic. The head police officer at the Kootenai tribe is a white guy. So they're used to working with Caucasian professionals. So that, I believe that pattern that has been set long before I came along has lowered some of that fear or expectation for tribal members, in that they are kind of used to working with Caucasian professionals. So that helps a little bit in terms of breaking the glass or chipping through. So I'm going to move forward, and again, these first 3 slides, there's some of it's wedded together, and there's some overlap, of course. But transitioning from being the white therapist, okay, so since that's the case, and there is this traumatic history and background, how do we earn trust? How do we break the ice and develop the relationship that's necessary to earn trust in a population that's understandably cautious? They should be. Because of history, Native Americans are often very cautious. And as I said, they've got a history of Caucasian professionals that are pretty used to people telling them what they think's best for them, people that want to help. And I say that very specifically because that's another thing that I've seen as a theme with some repetition in my work with the Native population. Is they're like, oh great, here's another white person coming in to help the Natives, right? And because everybody comes in with the best intentions and all these great ideas, and then they want to change everything. And they sit around and wait until that person gets burned out, and then the next person comes in with all these great ideas and wants to change anything, and they wait until that person, and you see this pattern over and over and over. So we want to be aware and cautious of that. We want to be cognizant of that as a pattern, because that can definitely get in the way. So I really work to set the intention of following the lead of the client, challenge by choice. They're in the driver's seat, and really encouraging them. And that's a fine line, of course, because they're not used to being in the driver's seat. They're used to kind of being told what to do and where to go. So threading that needle between being directive as they're used to and allowing them to be in the driver's seat has been a tricky thing for me to navigate, and definitely learn some things along the way. Again, a healthy sense of humor goes a long way. Having that opportunity to make fun of myself, make fun of humanity, finding the humor in things is something that in my experience, they have, they connect with very well. That humor has a great way of disarming and can ease some of that caution. Again, talking about validation of the traumatic history, being specific to the tribe that we might be working with, if possible, and in that validation of tribal history, each and again, I'll get to this a little more detail in the next slide, but I find that very helpful and very important. The book, 7 Habits of Highly Effective People, I know that it's kind of gotten franchised, and is in my opinion, the power and importance of that book has been watered down a little bit. There's 7 habits of everything, highly effective pets or whatever. But that initial book is very valuable, and I use the concepts quite often, and it is specifically to this topic and exploring ways of earning trust that seek first to understand and then to be understood. I really think it's important and valuable in working with Native populations to listen, to slow things down, use motivational interviewing, and really work to listen and allow them to be heard, because that's the point of it all, right? And that's really the best way to work to earn trust, is to really genuinely try and be authentic in how we are trying to understand where they're coming from, and not be pushing an agenda, being authentic in that open presentation and seeking that from their perspective, and that's helped open doors for me in terms of earning trust and being the white guy that's here I am trying to help and chipping through some of that armor that's understandably been built up over generations. Which brings us to the idea of researching culture and creating a greater understanding on making that connection. We all know as clinical therapists, whatever the orientation or however our approach to our clinical process, really the relationship is of vital importance, and creating that trust that we're talking about earlier, but really making that connection is an important part of working with people. And in working with tribal members, there's I feel like that's even more true. There's more of that relational capability focus from tribal members. They are vastly less impressed with credentialing, whether the letters behind your name, the school that you went to, any of that kind of stuff really pales in comparison to how I present with them when we're face to face. Do I have the capability? Can I show a functional capacity to be effective and connect with them on a human level, on that spiritual level? Is vastly more important to them than any credentialing or whether somebody went to Harvard or not. So know that I feel like it would be hard for me to emphasize that enough in working with populations. To the point for myself that, and maybe this is more of an indictment on me than anything else, but I don't put my degrees on the wall. The law requires us to have the one little ripped out one that is still that says, yeah, I'm licensed, but I don't cover my walls with credentials with tribal members, because in my view, it comes across as a little pompous. And I know that this population, that's not what's important to them. And so I don't try and really wave that flag very much. I think it's way more important to do your homework. And again, this goes back to the prior slide. Every tribe has their tribal story, right? Every tribe, and they're all very, in general in North America, the tribal stories are very similar, but they're all very specific as well. So do your homework, know the tribe that you are fortunate enough to be working with. In the Kootenai Tribe of Idaho, they created a book called The Century of Survival. And this is something that I utilize very greatly. It talks about the history of the Kootenai tribe, both the pre-colonial history, what they were doing in this area for thousands of years, and then what happened when the white man showed up. And the century of the tribe's vast efforts to survive, despite real, very specific and direct efforts to be stomped out by the white man, by the Caucasian culture, and by all of our norms. And so get that understanding of the tribe that you're working with, and know that that is going to be individualistic. And the more familiar we can get with that story, then as we start working with the specific individuals on a clinical level, it's really amazing how some of those pieces start falling together, and we can start seeing. And I'm segueing. I'm getting a little ahead of myself. I'm segueing into that multi-generational trauma idea, but you can really start to see how some of those pieces fall into place to create success and failure for this population. I very much encourage and enjoy myself participation in cultural and tribal activities. Show involvement, show investment. And there's a lot of stuff that is totally appropriate for the white guy to go and be a part of, and there's a lot of stuff that is just simply not appropriate for me. And I don't know all of those yet. I certainly didn't when I first started, but one of the things that I have learned is ask. If you have an investment, if you want to be a part of things, that will show. And when I ask if I can be part, the Kootenai tribe has all kinds of different ceremonies, be involved, to go to tribal council meetings. Yeah, obviously, it's not appropriate to go to every one, and you probably wouldn't want to. I certainly don't have time to go to everyone, but try and schedule time to attend one. Let them know who you are. Show some of that genuine authenticity to the tribal council. It's a little intimidating. Lean into it, be enthusiastic and humble and appreciative of those opportunities. Go to powwows, see them dance in the regalia, be a part of things. The Kootenai tribe does school award ceremonies separate from the public school. They just do them for the Kootenai tribe out on the res. And I always work hard to go to those because it's a great opportunity. All the families there, they eat pizza, everybody's sitting around in different ways, clapping for the kids' success. That's a really wonderful thing to be able to be a part of. And then, of course, there's things that aren't appropriate. There has been several ceremonies that were coming to town that I knew about, clients are talking about, and I'm all excited. And so I go to tribal council and say, hey, is that something that I can do? And they're like, yeah, right. No, yeah, that is not appropriate for you to do. Okay, but I've never felt like they were offended that I asked. They'll be direct, they'll be clear on what is and is not appropriate. But for my situation, I've never felt like they were like, oh, how dare you ask? They'll just be like, no, you can't. I remember once there was a funeral, and there was the traditional, more like Christian funeral, and then there was native ceremonies afterwards out on the res, and then they did the burial out on the res. And I was hopeful to be able to participate in that. And they're like, yeah, no, not. Understand why you might want to, but that's not appropriate for you. Okay, great. Certainly no offense taken. I'm an open learner. Thank you. I won't ask again next time, and everybody moves forward. Finally, I'll say earning the affection of the kids has gone a long way. That's really how Rawlings Community Counseling, our agency, got our foot in the door with the tribe, is by working with the children. And in doing so, of course, then you meet the families, the grandparents, the aunts, uncles, the parents, and we'll talk about family dynamics here in a minute. But once we gained the children's trust, that went a long way in working to earn the trust of the parents and families, the adults in the tribe. And after working with the kids for a while and getting to know them, again, fortunate enough to be able to have a family name that has some respect in the community, and that is really what broke through to having greater access, and ultimately being able to be the therapist out on the reservation. It all started with working with the children, and that's a great way to kind of get going with them. I know I've been yammering for an hour now, or I'm sorry, for a half an hour now. Before we start going into discussing expectations and multi-generational trauma, the more clinical aspect, it's an opportunity to pause and say, are there any questions about these first ideas, addressing being the white guy, researching culture, and exploring ways to earn trust? Is there any questions out there that I might be able to be helpful with?
Hey, Chris, this is Anna. At this time, I don't see questions. There might be some that roll in since you just prompted, so I can go ahead and just call on if some do come through while you're moving on.
Okay, awesome. Yeah, well, just in review of that sort of first half, I'll reiterate a couple of points and then we'll move forward. I think that the best way, the most appropriate way that I have had experience with addressing being Caucasian is just own it. Just say, yeah, I know that's a super tragic history. I'm sorry. And I really appreciate and feel honored to have this opportunity. And then that starts earning trust and really recognizing and honoring their caution, rather than trying to bull in a china shop through it or any of the other ways, but really humility and honoring that process. And then, like I say, really doing homework, really working and showing the investment in trying to understand the culture, trying to understand the history, and being involved, even to the point of them saying, no, it's not appropriate for you to come, working with the children, getting in with the families. These are all ways that myself and the other therapists with our agency have had some success in earning trust and breaking down some of the barriers that have happened over time. Well, if there's no other questions, or no questions at all, and no other about it, if there's no questions, then I'm just going to keep rolling here, and I'm going to forward. Now we're going to transition into a little more clinical aspect, starting with discussing expectations both for the therapist and the client. And I say that about for the therapist first, on purpose, because I always, as a clinician, feel like it's important to continually go back and start each relationship with checking my expectations. Like, okay, this is not about me. I work hard to take my ego out of it. I don't say I'm perfect by any stretch of the imagination, but I'm at least aware that that's part of the process, and trying to check our expectations as therapists. And that's definitely true in working with tribal populations, because it is very different. Really working to have an open mind, working to have an open heart to the process, and see how it unfolds, rather than trying to work and guide and expect or feel like a failure if it doesn't unfold in the way that I thought that it should. I think that it's important in all aspects, and that's really become clear in working with tribal populations. Many tribal clients initially struggle having the language to talk about their feelings, to talk about their issues. They're not used to being in the driver's seat like we were talking about before. They're used to being more directed, more told this is what they're supposed to do. So working with that balance is a challenge. And doing that trust building, using motivational interviewing, and trying to cultivate their ability to articulate is something that I have realized is more of a challenge with the Kootenai Tribe of Idaho than with some of my white clients, some of the clients in the other part of the community. Some of the things that I found to be helpful in saying, okay, you're coming into therapy, how can I be helpful? What is it how would you define success? And they're like, I don't know, I feel like garbage and I don't want to anymore. And I'll get a little bit ahead of myself and drop down to the bottom of this slide. I've developed this phrase over time. I'm sure I'm not the first one to use it, but I talk about gun to the head versus internal motivation. By gun to the head, I mean there's an authority, probation officer, the tribal court, the county court, somebody is telling them, you need to go to therapy or else you're going to do more jail time, or some of these kinds of things. And so somebody's got a gun to their head making them do this. And I have expanded that onto, like, maybe the school is mandating treatment, or their parents are forcing the child to go to therapy when the teenager doesn't want to because they know everything. So when we talk about that external motivation, that gun to the head, you're going to do this or you're going to be in a lot of trouble, versus internal motivation, I have found with tribal members, these same rules basically apply. All this stuff on this slide that we're talking about, the same rules apply. We want to work to ask them what they want. Okay, I get it. You're being forced to be here, or you're coming in on your own. What are your expectations? And really working to navigate them, to find that language through motivational interviewing, through paraphrasing and exploratory questions, clarifying questions. Paraphrasing has been very helpful, and I really want to make clear the difference between paraphrasing and parroting. Nobody likes to be told exactly what they just said and then be like, is that what you said? Yes. Paraphrasing, coming up with a different angle on it to show, yeah, I think I get what you're saying. Is this correct, right? Helping them work with that language through, with developing that language through rudimentary CBT skills building. And I really mean rudimentary. This has been true for the Kootenai tribe, whether it's adults or children. they don't really have an emotional language. They don't really have a language to explore their prior trauma because they haven't had that opportunity a lot of times. And so I'm literally in cognitive behavioral theory terms, I'm talking about mad, sad, glad, scared. Like really basic kind of emotional expressions. And then if they have those concepts, I found we can move forward very quickly. But if they don't have those concepts and I start at a higher level, then my fear is that they're going to feel dumb. That's the last thing I want. And I definitely learned from this. I've had them agree with me when they didn't understand. And then I get down further and I realize, oh wait, they agreed, but they're not actually caught up. They just didn't want to admit that they didn't understand. And they're used to white people telling them what to do and they say yes. And so trying to break that habit by starting at a more basic level. And if they're more advanced than that, then it's easy. You can move forward more quickly. But I would way rather start low and move quickly than start high and have to backtrack. That's backfired on me. So please learn from my mistakes. Treatment planning is always a challenge because the goals are supposed to be our clients, and we often know how difficult that can be, especially when somebody's got a gun to their head, right? Like, what I want is to not be in therapy anymore. I don't want to be going to jail or being told what to do all the time. And so asking the miracle question, if you woke up and things were just the way you would want, what would that look like? And then kind of backing up from there, and what can we start in terms of goals and objectives to work towards some of that. I've had some success in that. Scaling questions are very helpful with my tribal clients and children. Because that can give kind of both parties, myself and them, that context for on a 1 to 10 scale. Where would you, how would you prioritize this or that, and can help with developing some of that language. And then, as I said, same rules apply in terms of gun to head versus internal motivation. Really working to develop that language on either case. Having a greater understanding for multi-generational trauma and the impact on the clinical process. And this was an eye-opener for me. I've been working in one capacity or another in a helping profession for 25 years. I thought I had heard a lot of very tragic stories, and I'm telling you, if you're working with tribal population, buckle your seatbelt. There is trauma like I was not really aware or able to comprehend based on the prior populations that I was working with. And one of the things that really struck me is how matter of fact it was discussed. How it's like every ordinary day kind of discussion, and they're talking about how grandpa was murdered and grandma was in jail and raised by a cousin and living in out of a car. Like, oh, I can go on and on. And I'll tell you what, we'll talk about it in terms of self-care as we get towards the end, but that multi-generational trauma and the weight that carries, as therapists, we absorb a fair amount of what comes into the chair in front of us. And boy, howdy, that has been true for tribal members. So really be prepared to hear horrific stories and wonder how it can be discussed in such kind of matter-of-fact terms. I think it's important to recognize that when a tribal member comes into my office, I'm working with that individual person. I'm working with their current family system, which might look like any of a million different combinations of friends and family, and the weight of their ancestors. All are coming in the door at the same time, whether that individual is cognizant of it or not. They might be coming in because their kid got kicked out of school and they don't know what to do. But they're bringing a lot of that in with them, even if it's on an unconscious level. And boy, it really unfolds as you start to do clinical work with the individual. Very, very often, and I'm maybe stating the obvious, but very often addiction and mental health issues intertwine in tribal clients. And it's a chicken or the egg kind of thing, which came first. It's really hard to separate that, and oftentimes I don't even pretend to try. We're just working with what's in front of us, but understand that co-occurring disorders are more common than not. Within the individual, and then of course within the family system. The families are I'm trying to make sure I don't make a unilateral statement, but I can't think of a tribal family that I'm working with that didn't have some sort of blended family combination. Of course, working with tribal families, there's often multiple generations in one household. That's very common in this area. So when we're working with the people, they often make reference to grandparents, aunts, uncles, cousins, all living within the same house. And often with the Kootenai tribe, and this was an adjustment for me, I'm looking at the clock because I realize that time is of the essence, but when working with the Kootenai tribe, they'll talk about mom or auntie, and when there's no biologic relation, and really fishing through. And if the opportunity presents, I would encourage people working with tribal population, do a genogram. It is a challenge, I'm telling you, but do it anyway. Try and frame it out on a whiteboard or whatnot on where things went from grandparents to parents to client to their children, and see how it's fragmented. And it really gave me that concept of, well, of course this person isn't grounded. How could they be grounded? They've got this great and vast tribal history for thousands of years that is well established and rooted in the earth and Mother Nature. And then within the last couple of generations, it's gotten this fragmented. And there's going to be a lot of dysfunction and confusion involved in that. And therefore, the substance abuse and the mental health issues all cascade down as a result. Do a genogram with a tribal family, and it's an incredible learning experience. Of course, once trust is established in a relationship, trauma work can begin, but we want to establish that trust prior to diving in. And they may bring up trauma that, as a therapist, I want to explore. When they talk about it as matter-of-fact terms, I'm like, whoa, wait, wait a minute, what are you talking about? But be cautious about doing that too early if you don't feel like the relationship is established. Again, what are my expectations versus what is the client's expectations? I try and curb my expectations. I want to hear the story and explore that trauma and know that that's got to be rooted in some real core issues for the person. But is that relationship established yet? Is that the direction that this individual wants to go? And check that expectation. I'm a firm and big believer in EMDR. If you are not an EMDR therapist, I would encourage that. I don't think that everybody has to, or else, that's not what I'm saying. But I really feel like it's a very valuable tool, especially in working with tribal populations, because EMDR is a vital way to work with trauma in a way where they don't have to verbalize like they do in talk therapy. They're able to use that dual stimulus to be able to be in a safe room while exploring past trauma and not have to come up with the words all the time. If you're familiar with EMDR and have utilized it to any degree, you understand what I'm talking about. And I really encourage ongoing training in EMDR and ongoing use of EMDR if you're going to work with any major trauma population, veterans, victims of sexual abuse, tribal populations, because it's such an incredible and amazing tool to be able to do some of that deep trauma work for people who are developing that language to understand what happened to them and be able to start to talk about it. EMDR is a very effective technique and will help with the later on verbal processing. Really understand that idea of multi-generational trauma is absolutely real and will show up in working with tribal populations. It's tragic, and it's amazing to be able to be a part of. Addressing the family system and family participation, like a lot of populations, you get families who, my kids, being a bonehead, fix them, and they drop them off and they go off for an hour and they come back and pick them up, right? I'm sure there's a lot of heads out there nodding that understand where I'm coming from. With tribal population, I encourage family involvement while trying not to be pushy or forceful. Again, check my ego, check my expectations, work with the client. There are times the client might not be in agreement with family being a part of things. I'm a licensed marriage and family therapist in the state of Idaho and was in Montana. I've let that one go, but have been in Montana. I'm a LMFT. So family and systems therapy is like my jam, right? But and I've known other LMFTs that will, if we're not working with the family system, I'm not the therapist for you, and they'll refer them on. I'm not that way. If the client's not in agreement with family participation, I recognize there may be limited success until that family dynamic can be addressed, especially given some of the chaos and dysfunction that I have heard about from the client in their home. And like I was trying to remind myself, there's 168 hours in a week. I might get them for one of those 168 hours. The other 167 hours, they are out there and in their community and in their home and in their school and with their peers and with their family system. And so I recognize that there may be limited success in that 1 hour of 168, but it might not be safe for them to bring family members in. It might be the very best thing that I can do to assist this person is to help them be more grounded in their value system, in what they want as they are looking forward, and really working on internal resource building, on internal grounding and DBT skills. And again, with the Native population, I rely heavily on their cultural system, on the Kootenai Tribe of Idaho's past history, and will have them take their shoes off and stand outside in the sunshine and do some of these kinds of things that are earth-based, that are nature-based, that are based out of their spirituality, that can help them be grounded. Because it might not be safe to bring the family into it. The family may not want to and be very resistant to that. And again, sound like a broken record, but safety of the client is of vital importance. I also want to recognize that confidentiality with the Kootenai Tribe of Idaho has a whole different meaning than it does in our private practice office here in town. I don't want to disregard HIPAA or confidentiality. I'm just saying that the way that my office was set up out there, it was a house that was split in two, right? And I had one side and tribal court was on the other, and it was just like a studio apartment. And so clients would come, there wasn't a waiting room, there's no receptionist or anything. And I'm used to being here in town where everything is HIPAA, man. We drive that home with our therapists on an ongoing basis and being in compliance. And there, like I'm working with somebody and one of their cousins will come in and literally like walk in without knocking, open the door and say, hey, Susie, we're ready to go to Walmart when you're done with your appointment. And I'm tripping all over myself thinking HIPAA and confidentiality and oh my goodness. And to them, totally no big deal, normal. They all, like any small tight-knit community, they talk amongst themselves and get in each other's business all the time and have all of that. But yeah, the confidentiality piece, and I learned that that is generally true in the tribal clinic as well. The waiting room at the tribal clinic is kind of a social area. It's warm, there's coffee there, there's people coming in and out, they can get attention, so it's important to work to respect the boundaries of our profession and understand that can be tricky to navigate, or at least has been for me at times. Finally, with a few minutes left, I want to talk about self-care in order to continue to be effective in our clinical practices with tribal populations. I'm very aware of the transference and that vicarious trauma idea. Like I say, so I've got 6, 7, 8 clients in a row of tribal clients. I remember, especially early on, before I was kind of in shape for it, and I'm coming as a white guy from private practice and going out there and all enthusiastic, and I'm just hearing these stories, and it's an 8-hour day. You know, I got one client after the next who's just coming in and dumping this stuff that is really, really heavy and really, really hard and difficult to be in the same room with. And then it's like, okay, dust myself off, they leave, next, and again, and again, and again. And really going home feeling like I've just been hit by a truck, you know, just exhausted from fielding all of this. And so be aware of burnout, schedule breaks in the day as is appropriate. I always really work to try and bring healthy food, drink lots of water throughout the day and try and keep that up and not power through. Have a plan for self-care afterwards at the end of my day and get a workout in, go for a walk, take the dog out, whatever makes sense, but kind of that way of literally taking a shower, those kinds of things to try and shed the day and not bring it all home with me, because that could be a challenge. But like I say, my wife and I own this agency and we're both therapists, and it could be a challenge to come home and not continue to talk about all the stuff that we just did for 11 hours and then go to bed and get up and do it again and again. So as always, really, really work on self-care. Seek counseling for ourselves as is appropriate or necessary. Definitely working clinical staffing. We never want to do things in isolation. It's important to bounce things off of other professionals and say, hey, I'm thinking about doing this, or I did this with this population. Does that sound right? Other ideas, more heads are better than one. So really aware of the impact of trauma in these in working with tribal populations, because it's tough to sit there and feel that and then try and go out and go to the grocery store and that kind of thing. So that's the presentation I had. Pretty darn good on timing from the clock that I'm looking at. Anna, are there any questions that have popped up that I might be able to field before we sign off?
Yeah, yes, we do have a question actually. It's a two-part question. The first part is, do you do outreach on the reservation, and how do people learn about your services?
Yeah, good question. Thank you. And the answer is yes. I actually have an office out. My pen. Out on the res. And I say that a lot of people, they kind of flinch when a white guy says on the res. That's what they refer to it as. That's what they call it. That's what everybody calls it. That's not a derogatory term. If I said anything else, I would come across as pretentious. So yes, I have an office out on the res. I work out there on Wednesdays. I do 1 day a week on the res specifically. I got an 8-hour day blocked out there, 10 to 6. Out on the res where I work specifically with tribal population and employees of the tribe. We also see clients here in private practice in town at Rawlings Community Counseling. And because it's an entire tribe and I've got 8 hours, so there's often more than that. And not every therapist is appropriate for every client. I might think I'm great, but if there's a female and she wants a female therapist, I'm not a female. So we're fortunate to be able to have other clinicians in our office that have a reputable name, that we've earned some of the trust of the tribe. And so they're not like just stuck with Chris. They can have other options. They're not just stuck with Wednesdays. They can have other days based on scheduling, or if I fill up, or these kinds of things. And so you can learn about our services through Rawlings Community Counseling. Has a website, as does the Kootenai Tribe of Idaho. There's a website there. If you're looking on the Kootenai Tribe of Idaho and seeking that part of, I would encourage you to look at the tribal clinic, and that's how things get funneled down to the clinical department, is through the doctor and the nursing staff, and then they make the referrals from there. I believe that answered the question. Did I cover it, Anne?
Yes, that sounded great to me. You have one more question from someone else. Is there any specific family systems theories that you like to utilize?
Yeah, that's of course a tricky one, and I guess my direct answer in the very brief time that we have is not really. I don't have any specific theory that I adhere to. Again, I go back to developing a relationship with the client and then working with the general idea that all of the system, including family work, etc., impacts the individual. I tend to be very strength-based and Rogerian, and trying to work with those internal resources to assist with the individual within the family system and developing assertive communication skills and so on. But no, I don't really have one that I'm specifically attached to. I think of it more as like common sense, what shows up, and how to be adaptable as things present to me in a clinical fashion.
Awesome. Thank you so much, Chris. So just so everyone knows,
thank you guys. Thank you very much. Those of you who are still on, I know everybody's got to go to lunch and I got a meeting to get to as well. I appreciate the opportunity. Thank you.
Awesome. Yeah. Thank you so much, Chris. We'll be talking to you soon. Thank you, everybody. I have the registration link for our webinar tomorrow on Recovery with Scott Jones in the Phoenix in the chat box. I also have the link to our newsletter to subscribe for more events like this. Thank you so much, Chris. Have a good rest of your day. Thanks for joining us, and I'll let you go. Get to your meeting.
Bye, everybody. Thank you.
Bye.